everybody, I'm Julie John, and I'm here again with Dr. Bob Rothbard from Rancho, Cucamonga Optometric Center. He is our resident optometrist in charge here, telling us all the things we need to know about vision. We're going to talk, Bob, about eye health and how can my body be sort of a temple for my eyes. Now, my dad, he's very into health, very into supplements.
Good.
And I asked him, what's good for eye health? He talked about vitamins and stuff that are good for eye health, like these ones that you have here. He said that anything that's highly pigmented is really good for your eyes, and anything that improves your circulation and antioxidants are really good for your eyes. Is he on the right track?
He really is, Julie. Two things come to mind with the highly green vegetables, kale and spinach. Wonderful, because it has lutein in it.
Lutein, I've heard of that.
And that's really helps enhance the pigment of the eye. The other vitamin, zeaxanthin.
Oh, yeah.
That you get from goji berries. And that's one of the major sources of
wow. So those little goji berry snack things that you see at health food places. I
never even heard of goji berries until I took some continuing education courses of this stuff.
It's funny. Some of these things come from the high mountains that are really good for circulation and antioxidants. And I think goji berries is like from the Himalayas or something.
I don't know where it's from, Julie, to be honest with you. But, anything that's good for the body, the eyes don't function as a black box. Anything that increases circulation, as you stated, so forth, is going to help the eyes. And one of the most devastating diseases that anybody can ever develop later on in life, and usually it's associated with age, is, of course, by the name, age-related macular degeneration.
Oh, yeah, I've heard about a lot of people getting that.
It really makes a difference if you start taking care of yourself. And also working out, for that matter. If you're increasing the oxygen
flow, I was going to ask you about that.
Absolutely. It has to have an effect on that fish oil, the omega-3s, and in combination with the other omegas.
You're kind of an avid exerciser yourself,
Oh, yeah, I enjoy it. I have such attention deficit, it just really helps me cope.
It helps you
I do a lot of spin classes.
Get centered and spin classes.
It really does.
So is that where you get in the middle of your room and just spin around in circles?
No, it's on a stationary bicycle. But one of the things I want to really bring out is an issue with beta-carotene, which most people have heard of.
Sure.
And a lot of the vitamins aren't containing it because you got to be careful if you're a smoker with beta-carotene.
Oh, really?
Because it's been shown to enhance your chances of lung cancer.
Oh, really?
Yeah.
So just quit smoking, don't quit eating carrots.
Yeah, but the problem is I don't know if somebody quits smoking, how long that effect has.
Oh.
In fact, one of the vitamins comes for smokers and non-smokers, and the difference is the beta-carotene.
How interesting. I can just see someone with a carrot like this, anyway, that was just in my mind.
Very good, Julie.
Sorry. Well, that's interesting, Bob. So how about anything to do with, like, the way I eat? You talked about kale and spinach. Are there any other foods that I can eat that promote my eye health besides supplements that I take?
Well, tuna you better be careful of, eating a lot of it with mercury, but otherwise, that and salmon.
Okay. Salmon, you're pro salmon?
Yeah.
Okay, good.
And that would help the effect. Anything that, like I said, is deleterious to the heart would probably be deleterious to the eyes too, because
it's a $100 word right there.
Yeah. So these are things, promoting vitamins I do with some of the patients because I feel they need to know that this is out here and it can have an effect over a long term. And there are other forms of macular degeneration that are due to disease in the eyes, such as diabetes and so forth. And where before having macular degeneration was almost a sentence of going blind.
Oh, yeah.
There are things that we can do for it, especially what's called the wet type, which is due to blood vessel formation. It's been tremendous over the last few years where the eyes with certain types of treatment can actually become better.
Oh, that's
where it used to be a lifetime loss of vision was almost assured.
Yes. Oh, wow.
Again, this is outside the scope of my practice, my knowledge. But again, what I referred to earlier, referring to the right source is so important.
And keeping yourself healthy and eating the right things can maybe prevent those things down the road. So.
Well, obviously, if you're eating healthy and doing the right things and exercising, your chances of developing type 2 diabetes are tremendously reduced.
And that's
of course, that is definitely one of the biggest effects of diabetes is within the eye itself, especially over the long term.
Wow, that's great, Bob. You sure have a wealth of knowledge. Thanks so much.
Thanks, Julie.